Hello, everyone. Welcome to the First Parents platform. We're celebrating the Breastfeeding Week. Welcome, Dr. Ipshita.
Hi, honey. Thank you so much.
It's a pleasure for us to have you here. It's you have a very interesting background, and we're really excited to hear from you today.
Thank you so much. It's an honor myself.
Because you have so many qualifications, right? Pediatric dentist, you do functional. You are a myofunctional expert, eye specialist, as well as a breastfeeding educator. So I've never heard this combination where the dentist is also the breastfeeding educator. But I think that will make the questions more interesting for the session.
Yes, I look forward to this session, and I'm so glad you pointed out that there are very few pediatric dentists who really talk about breastfeeding. And I think we are the first people to see infants really small. So it's a good area to be in so that you can educate and spread the much needed awareness about breastfeeding.
Absolutely. Thank you so much. So I wanted to jump on right on to, the elephant in the room, right?
Sure.
Oral health is not something which is even something that comes to a mother's mind, right? So how is breastfeeding related to oral health? Because yes, every new mother's talked a lot about breastfeeding. We've done multiple sessions about breastfeeding, but the topic of oral health of the child never came in context of breastfeeding.
Sure. So, okay. So, how oral health is connected to breastfeeding is that firstly, you need the mouth for breastfeeding to happen. And it's very instinctive for a newborn, when he or she is brought close to the mother's breast to open the mouth and latch onto it, right? So in this entire process of latching on, what is really happening? The lower jaw is being made to come a little ahead. The lips seal onto the breast, and that's what a latch is. So it's like a workout for the mouth. Yeah. After the latch, it's actually a rolling action back and forth of the tongue, which pushes out the milk. And this entire process transfers the milk from the mother's breast to the child's mouth and then to the stomach and all of it. So this rhythmic feeding pattern actually is providing a natural mold or molding that is needed for the baby's mouth. The baby is, when conceived, is so tiny and grows, and then when he comes out, he or she is still molding, right? So breastfeeding actually is the first workout for the baby. So this latching and the jaws moving and the tongue going works to mold the mouth. Not only does it create wide jaws, but it also helps the lower jaw. So now when the child is born, the lower jaw is positioned a little behind compared to the upper jaw. Now this entire breastfeeding actually allows the lower jaw to catch up to its optimum position. Yeah. So breastfeeding also is the works where the baby is suckling the milk, swallowing it, and breathing at the same time. Yeah. So this suck, swallow, breathe art is necessary for developing a strong muscles. It is important for developing something called the airway. It is important for developing good oral habits. So breastfeeding actually works as the first training to set the muscles of the face and the neck going. And also breast milk is very good for the mouth. Even when the teeth come in, it actually is providing immunity and good saliva secretion. So it is very important for oral health. I hope that answers your question.
I wanted to ask you that, it's very important, and I've been a mother myself. I wanted to focus on the question that does physiologically the anatomy of a baby changes from sucking to eating around 6 months? That's why we start weaning, or does the process of weaning change the anatomy of the baby?
So that's quite a huge question, very honestly. So if I understand the question right, you're asking me, do we start weaning off at 6 months due to the anatomy of the baby? Is that what you're asking me?
Yeah. Do we start feeding and make them sitting and feeding because the way they suck the milk is different, right, physically?
So honestly, breastfeeding according to the international norms is carried forward till almost 2 years, or actually 4 years. We start solids because that's the time where your teeth start coming up and there is a change in the physiology and the anatomy and everything. but there is also the time where so like I spoke about the tongue being responsible for getting the milk out and everything, right? So it's only half of the tongue which really wakes up. But when the time comes and the teeth start coming in is also when you start solids. So giving solids allows the teeth to actually come. So, if you delay whole foods or you, only do purees, it delays teeth coming in. So if it delays teeth coming in, it's difficult for the child to eventually chew. So it all works in a pattern.
In tandem.
Correct. So we definitely start solids around 6 months because that's when the teeth also start coming in. The child is learning a lot of things around, he's discovered a lot of things, and that's when solids is included. So when solids is introduced, you're actually allowing the teeth to come up. So when the teeth come up, then the biting and the chewing and everything starts in. So that's when solids, and not just purees, but actual solids should be introduced.
Understood. Yeah, I mean, even I've been a mother. It's kind of very interesting for me to understand that. I wanted to touch upon this. Cavities. The word cavities is never associated with children, right? Like we think that cavities happen only later in life after milk teeth fall off. So does breastfeeding and cavities, relate? And if they're related, how?
Okay. So first of all, let me answer how cavities really started in the first place, not just in adults and children, but just how does it start, right? So this is, before pre-processed food times, when there was no concept of candies and the diet was a mixed bowl of raw and cooked foods. There was, biting into food and there was chewing of that food. And then came the wave of industrialization, and there was creation of packets and packaged foods. We reduced biting, or we forgot to chew also because there's lots of distractions. This is actually how we induced dental issues or cavities. So cavities is a lifestyle choice, right? Now breastfeeding is part of the fourth trimester, if I can say. So we learn a lot of things in that fourth trimester. So what I'm trying to say is breastfeeding is a very natural process, normal process, and breast milk is phenomenal for the baby, like we've already touched upon. So a lot of times, like I was saying, pediatric dentists also go ahead and say, or we have been taught to, in college, that breastfeeding causes cavities, but that's not true. Breast milk is very phenomenal. It has immune providing agents. It is sweet, but it is from lactose, which is a good sugar. It doesn't cause or is not going to really push the kind of organisms in the mouth to create cavities. It's the right kind of food. So breastfeeding will not cause cavities. The only way it is related is that if there is poor oral hygiene or post feeding, if there is no cleaning that is happening, there is an increased chance of decay. Now, having said that, later on, so like you said, only adults should have cavities, but kids also have cavities, and these kids are 3 to 4 years of age. So that time breastfeeding is not happening.
Yeah.
Right, but they're still getting cavities. So it's not breast milk that is only causing cavities. It's poor oral hygiene. It's even if broccoli is stuck, it can cause decay. Right. So the only thing is, no, breastfeeding will not cause cavities, but the lack of oral hygiene can. If there is something which is not allowing the breast milk to cleanse off, when the teeth come in, that can cause trouble.
Understood. It makes, I think a lot of us must have learned from this session that, cavities is not just for adults.
It is,
so what is
yes.
the difference between breastfeeding and, a lot of mothers who can't breastfeed directly, they pump, right? So what is the difference when you feed from your breast versus you use a bottle from an oral health point of view?
So I think, before I answer this, it is, I really want to make this clear that it's totally fine whatever feeding apparatus a mom chooses, right? Like you said, there are times you can't breastfeed and there are times you have to choose the bottle. So there are times you need to just tweak the way you are feeding so that a negative impact does not happen. And coming to your question, let's look at the anatomy of the apparatus, and the apparatus being the breast, yeah, and the other is the bottle of the nipple of the bottle. The natural setup, that is your breast, takes the shape of the baby's mouth, yeah. It expands, contracts based on the baby. Now, this is something the bottle's nipple, no matter how orthodontic and how natural it can't do. And even if it can, it is restricted to the amount a breast can. So when the baby goes on to latch, the anatomy of the baby's mouth is not modified or manipulated, but the tongue kind of goes in and sits where it needs to. It's a totally natural process. But when the bottle goes in, it is a harder object, yeah. So it's going to manipulate the position of the tongue, making it go low. When I say go low, it's going to stay in the floor, if you understand, of the mouth. So that is not a good resting tongue posture, right? And also, when you're bottle feeding, there is it's like the baby is just lapping up the milk. There is no control on the way the flow of milk is happening. Vis-a-vis when you're breastfeeding, the baby is really working out. He has to pull it out, and he's learning the suckling, swallowing, breathing, all of it. But when he's just feeding from the bottle, they'll take in and they'll not breathe for that much portion, and then they'll take in and then they'll not breathe for that much portion, and they'll take that many breaks. So the natural rhythm breaks out. So having said that, like I said, the tongue position goes off, and the tongue is the pillar of the mouth, yeah. So if that is positioned down, it's like developing an arch which is very narrow. Now when I say arch, I mean the jaws. Wide, well-aligned teeth come when the jaws are wide, right? So for that to happen, it's just best when you use the breast. But if you're using the bottle, there is a way to position the bottle so that the child actually has to put an effort of getting the jaw ahead and sucking the milk out. So that reduces the kind of impact bottle feeding could have negatively on the mouth. So if a child is either feeding from the breast or the bottle, the correct position helps to get the work done, and also does not have a negative impact on the oral cavity.
Thank you for explaining that in great detail.
Thank you.
So, what are the ways a pediatric dentist can help a breastfeeding mom? Because I know you have this, amazing combination of being a pediatric dentist as well as, a breastfeeding educator. What's the difference when, a mother comes in to you for a consultation versus going to a regular, lactation consultant?
Okay, so like I say, like pediatric dentists are the pediatricians of the mouth, yeah. And you definitely take your little one to a pediatrician. So it's a good idea to go to a pediatric dentist and go early, so that there are certain conditions which a pediatric dentist can see in the mouth, which will help you in the very initial stages. Now, when I'm saying the initial stages, I'm talking about the first 3 months when the baby is born, right? When you're really learning to feed, when you're learning a lot of things. So there are certain congenital or birth restrictions or things that happen in the mouth. Most important and most commonly now coming to know about is tongue ties. Sometimes kids are born with a band which is very short or very thick, which is not allowing children to feed. So moms feel that they're not producing milk, or they're not being able to latch onto the baby, or it's really painful. And that's not how a breastfeeding journey is supposed to be. So that's where I come in, and I'm able to look at the kind of restriction, if there is any. I also have a team of lactation consultants who I can't really do this consult without, because we work in a multidisciplinary approach. You have not just the eyes of a dentist, but you have the eyes of a lactation consultant. You have the eyes of body workers who really look at the holistic approach of why the child is having challenges or why the mom is having challenges. Yeah. So you rule out these issues right at the beginning. Apart from that, kids sometimes are born with teeth. They're called natal teeth, or if the teeth come out in the first 30 days, it's called neonatal teeth. This again causes hindrances to breastfeed, right? The mother will not be able to latch the baby comfortably. So that is something where I come in, and it's a very holistic or a prevention focused consult that you will see with me. So I'll be able to prepare parents beforehand. I will be able to let them know XYZ is what is there, and it's totally their call. There's no need to burden that, oh, you have to do it today. It's great to educate and create awareness. Apart from that, when they come see me early, teething actually starts as early as 3.5 months. Yeah. And this is just about when you figured out feeding. And then your baby will not want to latch because he's feeling irritation. So, preparing them, this can happen, and what are the things you can do to kind of be able to tackle the situation. That is how I would say a consult with me is different, because I would maybe look at just the teeth last. I would look at the overall health of the baby, and I will talk to them about how they are feeling and how they should not worry, and you must reach out for support if you're feeling something's off, because a mom's intuition, nothing goes beyond that, right? She knows best for the baby. So I think that's how it's different, or that's how I work when I see a very small baby in my clinic. So it's a great idea to have a pediatric dentist number on your favorites. It's good to just call and just check, everything's all right or no.
Sure. So wanted to ask you one last question, because you talked so much about oral health here, right?
Yeah.
At what age do you start cleaning the tongue of the baby, and how?
Okay. So great. So when a baby is breastfeeding, if you're seeing your baby's tongue to become white after the feed, a couple of things. Either the baby is not being able to feed properly, because when the baby feeds and the tongue goes literally till the top of the mouth, and that's what helps the milk also go in fast. But if it's staying on, that could be one reason it's staying on. So I would say as early as maybe 3 months, if you're comfortable, you can start cleaning the baby's tongue. If not, closer to when the teeth start coming in, you can start using a muslin cloth or a gauze, white, wrapped around your index finger or your tiny finger, whichever you're most comfortable with. And with it, just scrape a very gentle, scraping is a harsh word, but just a little brushing on the surface of the tongue to get remnants off, and just to introduce that as an oral hygiene routine is a great idea, because remnants even on the tongue are not good for the oral health aspect.
Thank you. I mean, I think that was a lot of learning for even me being a mother. We all apply different ways, but we always constantly learn. And one last question we had from another listener. At what age do you start using a toothbrush for the baby? And if you have any recommendations.
Okay. That's so I'll answer it in a very different way. So honestly, you can, muslin cloths and gauze works as fantastic first toothbrushes of babies, and this is even before teeth come in. So like I tell my patients, you don't need to wait for teeth and then you start toothbrushing. You can actually get into an oral hygiene routine when you've gotten hang of feeding, after you're fed, to just wipe the baby's mouth with a muslin cloth or gauze, gets them ready that, okay, I've been fed and now my mother's going to clean my mouth. So that's like a pattern that the child learns. So later on, when teeth brushing happens, it's a little less of a task. Slowly, when you get your first tooth, I usually recommend that's around 8 months, when you can really see the tooth structure, you can start using a small round headed toothbrush to clean the surface.
About 30 seconds, so I just want.
Yeah, so a round toothbrush works great till the age of 4, because a round toothbrush is better than a rectangular one, because it'll hurt the back of the jaw otherwise. Always the toothbrush should reach the last tooth in the mouth. So if you are not being able to reach the last tooth, you may want to look at a smaller toothbrush, not a bigger one. Yeah. Recommendations, there are so many in the market, but always go for a small head, softer bristles, and it's great to learn the technique of toothbrushing, because you can buy any toothbrush and the best of its kind, but if you don't know how to use it, it's going to not work well. I hope that's helped.
Yes, very, very helpful, and I'm sure we can do a couple more sessions. We have a lot more questions, but thank you so much for joining us today.
Thank you for watching. For more such videos, do like, share, and subscribe to The First Parents.